Hi, everyone. Sorry, let's get us all started here. There we are. So in this lecture, we are going to be discussing the major blood vessels of the body. There are a lot of blood vessels in the body. This image is showing really just the major ones. We're actually going to talk about a few extras that aren't in this image, but for the most part, you're kind of looking at a picture of this lecture. We're going to start with the arterial system, remembering that arteries, it's arteries away. So arteries are carrying blood away from the heart, okay, whether they are highly oxygenated or not. So what I mean by that is that the arteries in the systemic circulation, so the ones going out to the cells of the, most of the cells of the body are carrying highly oxygenated blood away from the heart, but the pulmonary arteries are the opposite. So they're carrying low oxygen level blood from the heart to the lungs. Then we have our venous system in blue in this image, and that's carrying poorly oxygenated blood back from the cells of the body, with the exception, of course, of the pulmonary veins, which are carrying highly oxygenated blood from the lungs to the hearts. Since we discussed the pulmonary arteries and veins in a previous video, we're not going to talk about those today. Today we are focused on the major arteries and veins of the systemic circulation. So this video is going to be a lot of this is this and that is that and this flows into that. And it's meant to be just kind of a walkthrough. It's certainly something you can find on your own. And depending on the textbook you've chosen to use, whether it's the one for this class or a different one, almost every textbook will have a nice, clear breakdown of this. And they'll have additional images. Personally, I really like the schematic type images. So instead of being actual anatomical images, it's more like arrows connecting things. You can see where this blood flows into this blood, flows into this blood, but that's not for everyone. So I know that the Tortora Principles of Human Anatomy definitely has that. But again, depending which textbook you've chosen to use, if you can't find it in the text, I'm sure you can find schematic artery or schematic vein images just on the internet. And I highly recommend them. I think they're really helpful. When you're studying these, so I'm going to walk you through all the major blood vessels today. When you're studying for the test, I highly recommend either drawing it out when you're studying or doing it with arrows, kind of flowchart style. Because what will be important is not to be able to label pictures necessarily, although that's certainly helpful. But what's also going to be very important is to understand the path of blood, okay? So when it leaves this artery, where does it go? When it leaves this vein, where does it go next? That kind of thing. So if I were you, when I'm studying the major blood vessels of the body, I would certainly study it from that perspective, okay? So without further ado, let's get started. We're gonna start right at the source, right at the heart. And as we know, when blood leaves the left ventricle, it's going to travel through the ascending aorta, then the arch of the aorta, and then the descending thoracic aorta, which is running behind the heart and right there, okay? You'll also see that labeled sometimes as the thoracic aorta or sometimes as the descending aorta. The problem with both of those names is the ascending aorta and the arch of the aorta, those are also in the thorax. So when you say thoracic aorta, that's not really detailed enough. Descending aorta is a little closer, but as you'll see a little later in this video, when we cross the diaphragm, the aorta is still going down, so it's still descending, but then it's in the abdomen. It's called the abdominal aorta. So by calling it the descending thoracic aorta, we are now distinguishing this part of the aorta from both the ascending and arch of the aorta and from the abdominal aorta, okay? So descending thoracic aorta is really the best way to label this section that goes all the way down to the diaphragm, okay? From the arch of the aorta, we have three branches. The brachiocephalic trunk, it's okay if you want to call it the brachiocephalic artery. And then that splits to give you the right subclavian artery, which is headed towards the right upper limb, and the right common carotid artery, which is going up the right side of the neck. Our next branch is the left common carotid artery, which is going up the left side of the neck, and the left subclavian artery headed towards the left upper limb. Now we're going to follow these common carotids up towards the head next. We are going to do the entire arterial side, then we'll do the entire venous side. This will save us a little bit of time because for the most part, when we get to the veins, we'll be able to say, this is the same as the arteries, this is the same as the arteries. In a lot of locations, they just follow nicely together and they have the same name. So when we get to the venous side, we'll mostly focus on the differences and we won't have to walk through each one the same way. Okay, so we're looking at a lateral view now. So let's orient ourselves. So here's our brachiocephalic trunk coming from the arch of the aorta. It splits to give, there's your right subclavian going to the arm, and there's your right common carotid going up the side of the neck. Now the right common carotid, same as on the left, will split, okay, before you hit the jaw, so before you hit the mandible, to give you the internal carotid artery and the external carotid artery. The internal carotid artery will enter an opening at the base of the skull and enter the cranial cavity. So it'll go inside the skull and supply much of the brain with arterial blood. The external carotid artery, as its name implies, stays external to the skull. Okay, so it's going to run right up the side of your face. It's going to give a fairly hefty branch just above your oral cavity. This is called the right maxillary artery, and it's called that because it heads towards the maxilla bone. Okay, and it's going to supply blood to this whole area of your face, along with this temporomandibular joint region here. Now, when you're studying, let me finish my sentence and then I'll comment on it. If we keep following the external carotid artery up, it also gives us the superficial temporal artery, which supplies much of the scalp, okay? So the wording I'm using here is a good way for you to use it. I will ask you which areas are supplied by which blood vessels, or on the venous side, we would say this vein drains this area, but it's worth noting that arteries and veins aren't super specific in their location. Okay, so an artery will kind of just dump blood everywhere it goes. It's not very specific to location. So the areas will be broad, like side of the face, kind of broad. And that's okay. So don't worry about being too specific. I just want you to have a general idea of the location, okay? More important is that you understand the path. So for example, a path, if we were following a drop of blood from the brachiocephalic trunk up to the scalp, your path would be brachiocephalic trunk, right common carotid artery, you do have to say right or left, right external artery, right superficial temporal artery, okay? All right, so now we're going to move back down to the heart, or close to. So let's orient ourselves. So there's our ascending aorta, arch of the aorta, and our three branches. And all I really want to show you in this image is if we go up and look at our subclavian, so there's your right subclavian, here's your left subclavian. There's several branches from subclavian artery, but I really wanted to show you this one here, and I'll flip on, yeah, it's fine, is the vertebral arteries. Okay, and I'm going to switch colors because that's not going to be great. So one is here, and they're going to kind of go like this. So one is there and one is there. And the vertebral arteries are important because these are headed up towards your brain. And I'm going to take you back quite a ways in the semester to when we talked about the vertebral bones. So if you recall, in the cervical vertebrae, there are little holes in the transverse processes. They were called transverse foramen or transverse foramina. And these holes are for the vertebral arteries. Okay, so the vertebral arteries travel through the transverse foramina of the cervical vertebrae, and they go up right along with the vertebral column. And when the spinal cord enters foramen magnum and goes into the skull, these two arteries are going to travel with it. Okay, so they're going to enter through foramen magnum into the skull and help supply the brain with blood. Okay, This is busy. We're going to now follow the subclavian artery further out into the upper limb. There are a lot of branches. Most of them aren't even labeled here. I just want you to focus, as always, on the specific structures that I talk about and not worry about the others, okay? So with the subclavian artery, we're going to get a good look at our first name changes. This is very common in the limbs because from a clinical standpoint, it's difficult if a blood vessel keeps the same name for a really long stretch. So for example, your subclavian artery starts here. If it went all the way down to the end of the finger and it was still called the subclavian artery, it would just make it a lot more difficult to describe to a clinician where the problem actually is. Okay, so what happens is when we have a really long blood vessel, it often changes names a few times so that we can use those terms clinically. So your subclavian artery, we're going to follow the right subclavian. Okay, it's going to pop deep to the clavicle here and move kind of towards your armpit. Okay, it's also worth noting, so it passes beneath the clavicle, but over rib 1. Okay, so subclavian artery is deep to the clavicle, but superficial to the first rib. And once it passes the clavicle and the first rib, it changes names to the axillary artery. Here's your spelling. Okay, so axillary artery. Axilla means armpit. Okay, that continues down to the point at which the teres major muscle inserts. So if you recall, the teres major muscle comes under the armpit and inserts on the bicipital groove, on the medial lip of the bicipital groove here. So at this point, we have another name change, and now it's called the brachial artery. Okay, so we pass the insertion of teres major muscle and the axillary artery becomes the brachial artery. We soon after get a branch, this guy here, okay, it's called the deep brachial artery, brachial meaning arm. The deep brachial artery is going to wrap around to the posterior of the arm, okay, and kind of dump blood all over the place back there. And now we'll come back to the brachial. So the brachial artery comes down, 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 and it's going to cross the elbow and divide, okay? So it splits right here to give us the radial artery on the radial side, so lateral, and the ulnar artery on the ulnar side, so medial, okay? The radial artery runs quite superficial, which is why you take your pulse at your wrist, okay? So your radial artery is very superficial at the wrist, so that's why you can feel your pulse there, okay? So that's with your radial artery. After it crosses the wrist, it divides into superficial and deep branches, which we'll come back to. The ulnar artery is running medially. It passes deep to the flexor carpi ulnaris muscle, and then it too will split to give superficial and deep branches once it crosses the wrist. Now, these superficial and deep branches of both arteries are important because they're actually going to join together to form what's called the superficial and deep palmar arches. So superficial palmar arch and deep palmar arch. And what that means is, I'll just draw it over here. So your radial artery is coming here. It gives superficial branch, deep branch. Your ulnar artery is over here, deep branch, superficial branch. And what happens is these join together, and then they get little branches and branches that go to all the fingers. And these are your two arches, okay? So superficial palmar arch, deep palmar arch. And this is what's called an anastomose. Okay, so we see these all over the body. That's an S, anastomose. And what this is when we have two arteries that join together, two or more, to supply blood to an area, okay? And we often see it in areas where we really have to make sure we always have blood supply, because what this does is it gives us a bit of redundancy. So if for some reason there's a blockage in the radial artery, that's okay, because the ulnar artery can now supply Both of these arches, all your fingers are still going to get blood, because if they don't get blood, really for more than a few minutes, you start having cell death. So it's really important that we have extra coverage, especially in certain areas of the body, okay? So that means that the superficial and deep pulmonary arches are getting blood from both the radial and the ulnar artery. That being said, each of them has kind of a major contributor. So the superficial pulmonary arch is getting more blood from the ulnar artery, and the deep pulmonary arch gets more from the radial artery. Okay, but again, they are there as a backup plan in case there's a blockage in one or the other, then the other one can fill in. Okay. We're going to talk a little bit about the thorax and abdomen. So in both the thorax and abdomen, we have what's called visceral artery branches and parietal or muscular branches. Now they do have names, but we're just going to group them as visceral branches and muscular or parietal branches. So we'll talk about visceral branches first. The term visceral means organs, okay? Which means these are the branches that are going to go to the organs. Now in this image, when we look at the thorax, these are going to be the ones that kind of stick out to the front, okay? So they're going to go to the heart, the lungs, things like that. So those are the visceral branches, and they come right off the descending thoracic aorta. So you can just call those the visceral arteries of the thorax. That's probably the best way to word it, okay? And they're coming right off the descending thoracic aorta. Then we have our muscular or parietal branches. Parietal is spelled P-A-R-I, that's an I, E-T-A-L, okay? Parietal or muscular branches, that's fine. And those are going to run right in the wall, okay? And they're going to supply all that musculature that's in the wall of the thorax. These are going to, once they all split up like this, they are called the intercostal arteries, okay? And they're really split up in this picture, posterior and anterior intercostal like that. Just the intercostal arteries is sufficient, okay? Intercostal arteries, costal means rib, intercostal means between the ribs, and you can see that we have arteries, these parietal branches off the descending thoracic aorta running between the ribs at each level, okay? All right, now let's look at the big guys. So our descending thoracic aorta is bringing blood this way. It's going to cross the diaphragm, which is here. And once it crosses, it's now called the abdominal aorta. There's your spelling, okay? And you can see that even in this image, they call it the thoracic aorta, but I'll ask you to please call it the descending thoracic aorta, just to make sure that you understand the difference between all of the different aspects of the aorta. The abdominal aorta is going to continue down to about the level of the L4 vertebrae, at which point it splits to give the right and left common iliac arteries. And we'll follow through with those in a later picture. But I want to go back up to the abdomen before we get too far away. Now, before we switch slides, I will show you. So we mentioned how we have visceral and parietal branches in the thorax. In the abdomen, it's the same thing. So the parietal branches, the muscular branches, are again kind of out in the back wall here. Okay, just like we saw them in the thorax, and they're going to stay a lot more superficial, and they're going to give blood to all of the muscles that are around the outside of the abdomen, okay, so in the abdominal wall. Our visceral branches, there were 3, so we're now looking at the abdominal aorta is back here, and then this is your large intestine. Okay, and we have a few aspects of small intestine sort of scattered in, and this yellow guy is the pancreas, and those are just there for reference for you. So for visceral branches, so visceral arteries means arteries in the abdomen that supply the organs, which in the abdomen is mostly gastrointestinal organs. We have 3 branches all coming off the abdominal aorta. So we have celiac trunk is first. Okay, so that comes off right here. Then coming off not far below it, behind the pancreas here, is the superior mesenteric artery. And then coming down a little further, right here is the inferior mesenteric artery. Okay, so those are three branches from the abdominal aorta, and those three branches, celiac trunk, superior mesenteric artery, inferior mesenteric artery, are going to supply blood along with all their branches to the organs or the viscera of the abdomen. And we'll take a bit of a closer look here just at the top two. So your celiac trunk is coming off here, and what they're showing you here is the crossing of the aorta through the diaphragm. So celiac trunk comes off just an inch or two maximum below the diaphragm, so it's quite high, okay? So in this image, the stomach is here, and it's kind of been flipped up so that we can see the pancreas and the blood vessels beneath it. So celiac trunk and all its branches, you can see that there's just branching all over the place, are going to supply blood to a lot of things in the area of the stomach and the liver. And then our superior mesenteric artery is going to come off an inch or so below it, okay? So it comes off the abdominal aorta here. Is it labeled? Yep, there we go, superior mesenteric artery. And all of its branches are going to help supply this area as well. So pancreas and a lot of the small intestine, and then some of the large intestine, because it's gonna kind of carry on, okay? And then inferior mesenteric comes off a lot lower, closer to about lumbar vertebrae 1 or 2. All right, so here's another look at those three, just if you want another look at them. So your celiac trunk is coming off here. So again, not long after your aorta appears below the diaphragm. Superior mesenteric arteries here, inferior mesenteric is there. Okay, and then as we mentioned, our abdominal aorta splits at about the level of L4 to the right and left common iliac arteries. Not long after, the common iliacs will split to give the internal iliac arteries, which supply organs in the floor of the pelvis. So bladder, reproductive organs, things like that. And then the external iliac artery, which is going to head out of the pelvis towards the lower limb. Okay, so the external iliac artery is going to cross under this big ligament. This is called the inguinal ligament. There's your spelling. The inguinal ligament is a piece of connective tissue that runs from the anterior superior iliac spine to the pubic tubercle. Okay, it's very structural. There's a lot of muscle attachment there of things like your oblique muscles, for example. Okay, very, very strong ligament. So your external iliac artery runs underneath, and then it changes names to the femoral artery. And now we're going to follow it into the lower limb. All right. So let's have a look up at where we just crossed. So we're looking at, we have an anterior image of the lower limb and then a posterior image of the lower limb, okay? So the external iliac artery crosses beneath the inguinal ligament, changes names to the femoral artery, okay, which is running sort of medial through the thigh right here, okay? Pretty high up, it gives a branch called the deep artery of the thigh, or the deep femoral artery is also a commonly used name. And if we look at the posterior view, we can see that it runs posteriorly and gives quite a lot of branches to supply the posterior of the thigh. Okay, now the femoral artery in the meantime keeps coursing down, and it's going to pass through a little opening here in the adductor magnus muscle. I don't know if you recall from when we covered muscles that there's a little space there right above where the adductor magnus connects, just above the medial knee. So the femoral artery is going to pass through an opening in the adductor magnus muscle and go posterior to the knee. It's going to cross right behind the knee and change names to the popliteal artery. Okay. We're going to have lots of branches here to supply the knee with arterial blood. And then once that artery passes the popliteus muscle, which is just inferior to the knee, we get a name change and a split. Okay. So it's going to divide to give us the anterior tibial artery, which is here. That's going to pass through a little opening above the interosseous membrane here between the tibia and fibula. So right there, so anterior tibial artery will then go to the front. Okay, so now it's on the anterior of the leg. So popliteal artery gave us the anterior tibial artery, and it also gives us the posterior tibial artery, which continues posteriorly along the back of the leg. Okay. Let's go back to anterior tibial. So anterior tibial will continue, like we said, down the anterior of the leg. When it gets down past the ankle, it becomes the dorsalis pedis artery. Okay, and then we get all these branches to the superior or dorsal surface of the foot. Meanwhile, on the back, the posterior tibial artery is running deep to the soleus muscle, okay, along here. And it's going to give a branch kind of high. This is called the fibular artery or the peroneal artery. And that's going to supply the lateral leg, okay? When we get down past the ankle, our posterior tibial artery will divide to give us the medial and lateral plantar arteries. And those are supplying the plantar surface of the foot. Okay, so they're going to have all these branches to the toes and all these other branches on the bottom of the foot. Okay, thanks guys. So we are going to actually stop there. I'm going to record the veins in a separate video. I'm starting to see a few little tech things coming up here and I don't want to risk losing the whole thing. So we'll stop here and I'll record the veins in a separate video. Thanks, see you next time.